Welcome to the Roche Idea Lab. Please welcome Angie Howard and Angela Baldwin.
Good afternoon, and welcome back to the Roche Idea Lab. Our Idea Lab is a community where we can come together to discuss the challenges we face as an industry. And it's a space where we can explore how to partner with each other and solve those challenges. Hi, my name is Angela Baldwin.
And I'm Angie Howard, and we're your hosts of the Roche Idea Lab. I'm the Regional Business Manager here with the Molecular Diagnostics franchise. I have 20 years of healthcare experience, 12 of which have been right here at Roche.
Thanks, Angie. And I'm a board-certified anatomic pathologist. I've been working as a pathology liaison in Roche since April. So we're both really looking forward to hearing the ideas that our guests are bringing to the stage, as well as your thoughts and insights.
So our Roche Healthcare Consulting team really brings a unique point of view in understanding our customers' laboratory workflow challenges. We at Roche have lab expertise and experience in change management and a thorough understanding of the laboratory environment in which you all operate. Our approach, backed by our ability to execute, is really what sets Roche apart as an organization. Today, we have with us several members of the Roche Healthcare Consulting team, and they're going to walk us through that exact approach. So please, welcome Jason Jackson, Sergio Sanchez, and Melanie Browning.
Woo. Well, Jason, Melanie, good afternoon. Thanks for joining.
Yeah, thank you, sir.
Good afternoon.
Great to be here with you. And for those of you who are watching us on the broadcast, thank you for joining us today. I hope this is a great experience for you all as we talk a little bit about some of the trends that we've seen in the laboratory and ideas on how to best address them. So today, one of the things or a couple of the things that we really wanted to focus on is how do we tackle some of the trends that are just growing and increasing in relevance and impact, potentially in a very negative way to the laboratory business and what us and our customers on the broadcast are feeling. Over the years, we've seen a tremendous amount of consolidation, right? Mergers, acquisitions, and all sorts of dynamics in the industry that are brought and created much larger systems than there ever have been before. Larger, complex, and diverse. And in this case, diversity adds a layer of, or several layers of complexity, especially when it comes to the topic that we're discussing today, which is menu consolidation, menu optimization across a network. Further, over many years, we've been seeing the trend of staffing shortages. And those staffing shortages, coming from a decreasing number of medical laboratory scientist programs, and just the kind of I'll call it the great wave that is coming of retirements that's already here and will continue for many years. Add that a pandemic on top of that, and all of a sudden we've got a significant increase in the pressure on both of those sides. So we got to be looking at ways in which we can do things differently. And one of the things that we see when we're out visiting with customers and working with customers as opportunities for improvement, opportunities for focus, is exactly this, looking at where are the efficiencies, where are the opportunities, especially when it comes to menu and menu optimizations and the value and the impact that can come from doing that. Now today, as we have this session, we'll spend some time with two individuals that have a tremendous amount of experience on this topic. So Jason, I'm going to give you a couple moments to introduce yourself, and then we'll go to Melanie and have her introduce herself.
Great, thank you, Sergio. My name is Jason Jackson, and I have 25 years of healthcare experience, 12 years as a medical laboratory scientist, and now 12 years with Roche Diagnostics.
Great, thanks. I'm Melanie Browning. I spent 28 years in the clinical laboratory in a large academic medical center where I was responsible for the core laboratory, which included 4 testing locations.
Wonderful, thank you. So the way that this session is going to go today is Jason's going to play the role of the consultant and the consultant leader who's been seeing a lot of laboratories over a decade of years. And Melanie is going to be putting on a bit of that hat that she had for quite some time, and the experience that comes with being a leader in the laboratory setting. And so, whereas she's been with us in our organization for a year, a lot of what you hear from her today relates to her experiences leading a laboratory organization. And my name is Sergio Sanchez, and I'm the Senior Director for Roche Healthcare Consulting, and I have the wonderful opportunity to be working with a tremendous staff of experts, and also to be able to see how things are working out there, kind of the macro picture of the laboratory industry across the United States. So one of the first questions that maybe I'll put out, and I'll ask to the audience that's out here, maybe by a show of hands, how many of you have been involved in a merger or an acquisition or a setting up of new laboratory over the last 3 or 5 years? Okay, we see some of the hands coming up. Wonderful. Just about everybody in the industry has been feeling the stress that comes from that. So in going to the topic that we wanted to cover today, Melanie, maybe I'll start with you and ask the question. In a setting of a consolidated network where you have all these historical layers coming together form a new whole, how did you think about the menus being offered and the menu strategies and standardization or consolidation of them?
Well, there are many things to consider, as you might imagine. So I'll share a few, maybe a little more. First and foremost is patient care, right? You got to meet your patient care needs. Whether you have a special patient population at a certain location, at the end of the day, patient care comes first. Start with the testing volumes, right, by location. Identifying what those low volume assays are to consider, hey, maybe those could be consolidated at a larger laboratory, for example, in a core lab setting. Which leads to the location of your laboratories within your network. How close together are they to where what kind of turnaround time delays would there be were you to refer certain tests to a hub, if you will? And so maybe a delay, maybe the turnaround time is 4 to 6 hours, and that menu looks different than if it were going to be 12 to 24, for example, right? So certainly things to consider. Obviously, staffing. Right, staffing. What kind of staff do you have available? And then what's their expertise, right? If you have some specialty testing that needs to be done, do you have the right staff there to perform that work or consider moving it elsewhere? Yeah. Along with staffing comes that productivity piece, right, of ensuring that your productivity measures are being met. Oftentimes in small satellite lab locations, you may have one person working there. Maybe it's a day shift, Monday through Friday operation, to where they're doing 75 CBCs a day. Well, guess what? That productivity doesn't look that great. So you may consider adding additional testing to improve your productivity in that regard. Well, instrument platforms. What do you have available at each site? If it's an acquisition or a merger, you may have to start with standardizing your platforms. You know, that would be a great place to start prior to making any other changes. And there's many benefits to that standardization in regards to staffing even, where you have those same test methodologies with reference ranges and SOPs, so that then your staff could potentially work in multiple locations. And so that's going to help in today's day and time, right? Yeah. And also your supply chain. You could share reagents within your organization, right? There's no challenges with that today, I'm guessing, right? And then another consideration would be the ordering patterns in these individual locations, because it could be that you have a very specialized patient population and they often order a TSH with their CMP. And so the goal is to have a lean workflow, right, in the lab. And so you want to minimize those touch points with those samples. And so it doesn't always make sense to say, I'm going to do just the CMP at this site and the TSH is at another location if you have to share that sample, right? So there's many things to consider.
Wow, after hearing you in that summary, my head's a little bit spinning, I'll have to say, and I can imagine living in the reality of having to do this. It's complex, it's large, but I do appreciate the focus that you put on here on people, and how do you enable and empower people with the right processes and structure. You know, I heard the concept of multi-skilled operators just coming out from you, from your ideas here. How do you prep and set up your teams to be able to do more than just one thing, because we need that flexibility now, right? We need to be able to transfer and shift and be agile in the way we provide services. and having the right SOPs, having the right standards is critical to be able to do that. Jason, maybe let's carry the same question. What do you see as you look at the industry, some of the leading laboratories, what is the approach that they're taking? And also as a consulting organization, what is the framework that you bring in discussing this topic with customers?
Sure. In my experience, leading laboratories make test menu optimization a priority in their annual planning cycle. So it's part of their standard work that they go through year in and year out. And the keys to making that happen are, number one, understanding the people involved, having the right stakeholders aligned on spending the time together, and creating the decision support parameters that empower the decisions. So when a new test is introduced, for example, there's a framework already in place that allows the physician team, the laboratory team, other stakeholders within the healthcare system to quickly decide how many laboratories should be running a particular test based on the clinical, operational, and financial criteria that they work on together and use to create that framework. As a consulting organization, we help customers navigate that complexity by providing the structure and framework to do that.
Yeah. And as you're laying out these three key pillars, I'll call them, of clinical, operational, and financial, maybe we'll take a little bit of time and dive into each one of those and see what that looks like, because they are complex and many stakeholders involved in all of them, and all of them are critical, right? So maybe we'll start with the clinical one. Melanie, I'll put the question out to you. What considerations should there be in place when starting to think about the clinical impact that changes or modifications to menu bring towards patient care and the enablement of physicians, right? They're making decisions on this information.
Yes. Really understanding the turnaround time requirements for certain patient populations, right? To where you're aligning with those stakeholders, those patient care providers at those different locations, and ensuring those patient care needs are met, truly clinical needs. It may be that it affects time to discharge in an emergency department setting, which is very important to the bottom line, right? It may be that this test result is needed to determine if treatment can proceed, right? A go, no-go situation to where that testing needs to be done and readily available. It could also be where an infectious disease result could be beneficial prior to a patient's discharge so that that patient could be referred to that specialty clinic. Because oftentimes once a patient leaves your facility, it's really hard to get them back.
Yeah.
And that all affects the bottom line.
Yeah, absolutely. Jason, any thoughts on that? Same question?
Yeah, I think when you think about clinical criteria to consider, one example that comes to mind that I worked with a customer recently on is something as straightforward as hemoglobin A1C. Every laboratory network requires that test, but it's often a test that's targeted to centralize to one location for maximum efficiency and minimal clinical impact because stat turnaround time is not typically needed. However, I was working with one client in the last year that had invested in the infrastructure and technology to really centralize A1C testing and do it more efficiently with fewer people involved than they had in the past. One thing they didn't consider, though, is there was a medical staff member at one of the affiliate institutions who had a very firm rule in his mind that he's not going to discharge a patient until he has that result. And I see heads nodding. That's the kind of thing, it can be overcome with the right conversations and the right context, but it was an obstacle on the path for them that had they gone through a process to really establish their reasoning for centralizing A1C, educating and managing the change of that type of decision, they could have prevented themselves some downstream inefficiency.
Yeah, and what you're saying here kind of triggers the thought of the importance of having data to support the storylines, right? I've heard it said that without data, you're just another opinion, right? And having those discussions around opinions, especially when interfacing with physicians, it's a losing proposition. Let's put it that way, right? It's very difficult to take on those discussions. So let's flip that question just a little bit and say, what are some of the objections that one can expect when thinking about making changes to the way that testing is done? Maybe the way testing has been done for over a decade, right?
I would agree with Jason with his example with what that physician was accustomed to. In the example of an acquisition of another laboratory, and that test menu has been in place for years, and then you're going to come in and tell me I can't have that right here and now, and that it's going to have to be delayed and sent to another lab. That's a tough sell because change is hard. And it really goes back to aligning the stakeholders, your lab leadership team with your medical directors, and then the patient care providers. And at the end of the day, the providers need to know they've been listened to, their concerns have been voiced, and that oftentimes you'll agree on what becomes the deciding factors, right? And then come to an agreement as to what the next steps are.
Yeah. Thank you, Melanie. Great points. Let's transition over to the next pillar of the three that we'll discuss today, which is operational impact. So understanding operations can be a very complicated thing, right? How does a laboratory leader today, I'll put the question out to either of you, what's the approach that is commonly followed today to understand operations and how healthy they are or how challenging they are, besides the hearsay of the anecdotal feedback of this isn't working well and all that, but without understanding deeper into the root cause? How does a lab leader get underneath all that noise?
First of all, you've really got to identify what your constraints are in your organization in regards to operations, because labs are often forgotten in administration. How many stories have we heard of a new lab is being built, but a new hospital is being built, but they forgot about the lab? So as leaders in the laboratory, you really need to be that voice, right? And even sound like a broken record at times. And so oftentimes space is an issue. That's a constraint for labs to be able to do what they need to do. And so your message needs to be consistent to your organization so that they understand, hey, the lab would be able to do this if I could find additional space or even build them a new lab. And so that as administration is working through planning ahead, they identify space that's available. Guess what? If you've had your voice and explained, hey, the lab needs additional space to make changes, then they're likely to think of you. You need to stay on their radar. It may be you need their financial support. That's oftentimes tough capital dollars to acquire. And so again, creating that business case of why you need an additional platform, for example, and what that's going to mean at the end of the day for patient care, so that when that capital cycle rolls around, guess what? You'd be more likely to get allocated dollars.
Right. Yeah, we got to be advocates for ourselves, right?
Yes.
Especially in the laboratory. To your point, perhaps not being top of mind, maybe the last few years have changed some of that dynamic. In fact, it has. We can't allow that to go back to the way things have historically been, right? Jason, any thoughts?
Yeah, when I think about constraints, I think it's important to not equate constraint with limitation. A constraint is not necessarily a limitation. I view it more as an opportunity for closer examination, and it's a factor we have to consider when we're making decisions. And if a constraint does become a limiting factor, then that can become a focus area for change. Some of the other operational constraints that in addition to space, people is front and center in that, right? I think people need to be a primary area that we think about how do we improve operation. When we're looking at people, it's a combination of talent, capacity, competency, and also geographic distribution. All of those things are part of our operational picture that really we need to understand first before we can begin making decisions about how to leverage those resources.
Mm-hmm. Great, thank you. Again, I'm loving what I'm hearing about the focus on people and kind of the multiple facets of that people topic, right? It isn't just about having bodies trained, it's also about location, it's also, there's so many components to the individuals as the prime resource that a laboratory has in place. Let's move on to the financial impact pillar and column that we have up here. Mm-hmm. What type of financial data would you say is critical to be able to tell that story to leadership, to gain their attention and the buy-in towards change?
Productivity
Sure.
is often really important in a laboratory setting. It may be that it's overtime, looking at how your resources are being utilized, and it may be that one location has some capacity and another one does not. So looking at those metrics. Obviously other things like ED length of stay, tying it to that, those are real dollars in an organization and usually speak to the financial team.
Yeah, right. So a combination of the internal operational KPIs that turn into cost savings, and then also potentially, I'll put it this way, the revenue enablement and the
Yes.
patient care side by reaching beyond and outside the laboratory. Thank you.
Yeah.
Jason?
So yeah, great points, Melanie. And I think historically in healthcare, when we talk about financial drivers, there's often a connotation that is going to negatively impact our people. We need to work with fewer people, we need to reduce hours. Those were historical things we heard, but I think the pandemic has fundamentally changed that conversation. And now we're dealing much more in an environment where people are precious resources that we cannot get enough of, even though we may have budget dollars to acquire them with. In that, I really like to encourage customers to start asking what I like to call an A&D question, where we take two seemingly separate or opposing points of view and try to combine them. And what I ask customers to pose is it possible to begin improving our financial picture and improving the satisfaction of our associates at the same time? And one area that I've seen laboratories begin to focus on that's a fairly easy one to track is overtime. Overtime has become a line item budget because of pandemic and retirements in every laboratory. I see heads nodding, right? You know you're going to spend a certain amount of money every year. That has the potential to become a key indicator of, if I can start to move that number away, I'm going to accomplish two things. Number one, for every hour I save 1.5 hours of pay. And then secondly, my employee satisfaction is likely going to improve if I am asking my staff to work fewer hours than over the last 2 years we've had to do.
So once again, I'm hearing the people topic
Yes.
weave through all of this, right? So I mean, to the title of this session, structure and people being central to an assessment and the optimization process across the network. Now, let's talk a little bit about that process. So we've got 3 pillars, right? If you think about a framework, looking at the clinical, the operational, and the financial impact, really important. We have to have our bases covered. We have to be able to get under the data, understand it, analyze it, and then be able to convert it into a storyline. Not an easy task. What does that look like if you were to put a project together? Jason, let me put this question out to you. How would that be structured?
Yeah, so when we're going to work with a customer on optimizing their test menu deployment across the network, we actually we take a people-first approach. The very first thing we're going to do to kick off a project like this is assemble the right stakeholders, and stakeholders are people. Get the right people together to meet and really scope the project and align on how we're going to measure our success. So this is that opportunity to really forge those relationships. You likely would need representatives from your emergency department, for example, your medical directors, your lead lab managers who understand the operation, as well as financial stakeholders that can help inform on what financial parameters need to move in the coming year. And we help customers coordinate that first meeting and really work through in a workshop format the scope, the decision parameters, and align on the path forward. At that point, that's where, as consultants, we're going to start some of that heavy analytic lifting, and we're going to do work in the background to help understand your current state of operations. So we develop a robust understanding of current state focused on those key parameters. So for example, if overtime is one of your indicators that we need to drive toward, we'll think about that. We strive to understand your operational capacity at the instrument level. Where can you potentially do more work? And from there, we're able to start doing future state modeling. when we talk about future state modeling, we're talking about moving tests around or moving volumes of work around. And we do that modeling for you and then bring that back and discuss it with the entire team of stakeholders. We compare the different models against the decision criteria that we've established, and from there we're able to align on a plan. Once we align on the plan, we're halfway there. Perhaps the most critical part is, again, taking that people-first approach and let's plan that change together. So we help with a plan to implement the changes and to prepare the people impacted for the changes that are coming, to help them be part of that change and feel empowered to participate in it.
Yeah. Thank you, Jason. I think something important to call out is the fact that, as I've heard from your discussions, Melanie, and also hearing from customers, we have the tendency as an industry to be a reactive set of organizations, right? We're putting out fires, we're really busy trying to deal with the here and now. And what this is kind of actually calling for is stopping, moving that off to the side and having a broader look into the future, being a bit more strategic. And that can be a difficult shift, right? Between the emergencies of today and the strategy for the future, right?
Yes, absolutely. Today, labs are just trying to figure out how to survive. You're absolutely correct in the putting the fires out on a daily basis. That is what consumes a lab leader's day, is putting the fires out, whether it's a staffing crisis, maybe you've had multiple call-ins, or it could be a supply chain issue.
Sure.
So always something to be done. And so initiatives such as test menu optimization, or fill in the blank for that matter,
right,
just seem to fall to the bottom of the pile. It's not that labs don't know what needs to be done. That's not the case at all. It's the fact that they are consumed with the day-to-day crises to where it just prevents them from working on projects such as this.
Right.
It has really come to a point now. Labs are very dependent on their vendor partners for that support to help facilitate that change in their laboratories, or even possibly provide data that will help with their decision making.
Right. Yeah, I think that's really important. Thank you for bringing that up. As we consider the various options, there's so many different ways. We're so used to thinking of the hub and spoke approach. But that shouldn't be a constraint, right? That is, again, one of those historical artifacts that tend to be just in the background of all of our minds. With the right data, with the right partner that can help us transition from the reactive to the proactive to the more strategic way of working, you can start exploring other approaches, other models that provide, shared specialties, hybrids, so on and so forth, distributed networks versus centralized networks. The options are pretty significant, and they're really the options are based on what is critical for your organizations. It shouldn't be a generalized model. It should be a model that makes sense for the needs of your teams as well as your internal customers, the physicians, and ultimately the patients. Really important, and that's where I think, to your point, Roche comes with a great opportunity through Roche Healthcare Consulting to bring some of that, maybe I'll put it this way, operational muscle, to bring additional capacity to make sure those projects do move forward, and that the right analysis is in place to support the right decision making, right? So in summary, I'll say it's critical for us to be thinking about these three pillars when we're thinking about network optimization and of the test menu. Really important to be very conscious about the clinical impact. Number one, most important, sine qua non. You cannot do without it, right? Operational impact is really important as well. You have to be focusing on how do you enable your teams, your people, to be able to do the best they can with the right structure, with the right standards, with the right environment. And finally, but not least importantly, the financial aspect, right? If we don't sell that story financially, it doesn't move forward. Any final thoughts from you, Jason? Let's start with you. Any final thoughts around the importance of this and the impact that a project like this can have towards better patient care?
Yeah, I mean, I go back to people. right? Our people are our most precious resources in the laboratory. And I think if we take an approach that puts the people front and center and really considers how we can give them the best opportunity to be successful and improve the environments that they work in, we're going to be on a path towards success. Whereas if we make blanket decisions based on a really rigid interpretation of a model. Hub and spoke's a great example of that, right? Hub and spoke works well conceptually, but if it involves impacting the people that you depend on in ways that are going to cause them to leave your organization, then it's not necessarily the best way to approach optimizing your menu deployment.
Absolutely. And again, I can't stress enough how lab leaders feel today with the amount of pressures and stress on them on any given day. And so looking to their vendor partners for that support to help really keep them on track and that accountability of having that support along the way while they tackle many initiatives. And they can remain intentional at accomplishing that test menu optimization or any other things they would like to address.
Yeah, thank you very much. And thank you for staying with us. This topic is really important. We understand the criticality of transitioning from a reactive to a proactive way of executing. And we look forward to the opportunity to connecting with you and seeing how Roche Healthcare Consulting could help bridge that gap. So with that, thank you very much for being here. Thank you for your comments and thank you for your time.